Kids in crisis are filling Seattle Children's Emergency Department.
We're definitely seeing higher rates of suicidality, so suicide attempts and suicidal thinking across the board.
A lack of available outpatient care facilities and healthcare providers means the ED is the only option for families. Nationally, emergency department visits for suspected suicide attempts increased dramatically in 2021, according to the Washington Department of Health. For adolescent girls, the rate increased nearly 51%. And for adolescent boys, the rate was lower, but still saw a nearly 4% increase.
So what do you think is driving this crisis?
The combination of things were already getting bad over the last decade, plus a pandemic that really has not been good for anybody's mental health, as well as not having a large enough workforce to meet the need, I think has really impacted us all.
Seattle Children's developed the Behavioral Health Crisis Care Clinic, and the goal is to provide resources for families, hopefully keeping them from needing emergency care.
The Crisis Care Clinic was built to provide families with kind of just-in-time access to care and to really set families up with the evidence-based care that they need.
But the need for care still far outpaces the ability to find outpatient solutions for many families.
And the reality is that we haven't had the ability to really meet the need. We don't have enough psychologists, psychiatrists, master's level therapists to meet the need to begin with. And then we've seen such a dramatic rise and increase that we just can't keep up.
The doctors I spoke with said this shouldn't be a deterrent from seeking help in the emergency department if that's your only option, but they do suggest reaching out to some resources and getting on wait lists early if you are concerned about your child's mental health. In Seattle, Kayla Lafferty, King 5 News.